I'm Dr. Anandh, a consultant oral radiologist in Rajan Dental Institute. In Rajan Dental Institute, we use cone beam computed tomography, and this is one of the very few institutes in India or a dental hospital in India which uses cone beam computed tomography. This is one of the advanced imaging modality in the sense of diagnostic specialty, because radiology is one of the integral part of diagnosis, where you need to diagnose the patient depending upon the pathology that is associated with it. So it's a three-dimensional imaging modality to view hard tissue structures, and it is not specially indicated for soft tissue structures. So it is different from that of computed tomography in the sense that the computed tomography, that is a normal CT that's taken outside, has a heavy radiation dose, whereas that is employed here, that is the cone beam computed tomography, has a minimal radiation dose, and it gives the structures as clear as that of the computed tomography. Here it uses a cone shaped beam, whereas in a CT the beam is fan shaped, and hence the slices of the patient are being imaged, and these slices were stacked later to constructing a three-dimensional image. Whereas in a cone beam computed tomography, it is just like a two-dimensional radiography that is being used with software algorithms to construct into a three-dimensional nature. It means it uses a cone-shaped beam. It just revolves around the patient. So you have an X-ray source and a detector which rotates around the patient in a 360-degree axis. As and when it rotates around the patient, it produces images. They are just like a two-dimensional images, which are called as the basic images or raw images. And these images are just they are just overlapped over each other to produce a three-dimensional reconstruction. So the advantage of the cone beam CT over the CT are having a very less radiation dose, faster time of acquisition of images, because a CT takes nearly 2 to 5 minutes to cover the maxillofacial region, and the radiation dose, as I said, is going to be very heavy. It means it takes around 1820 microsieverts, whereas it's up to 126 microsieverts. So 15 to 60% of the radiation dose is being conserved in cone beam computed tomography. Then the slices that are taken in cone beam CT are very isotropic, in the sense the pixels, in a three-dimensional modality we call that as voxels, are isotropic. That means all the planes, we usually, when you reconstruct in a three-dimensional plane, we have the axial, coronal and sagittal. These are the three planes, and these three planes are equal in cone beam computed tomography, whereas since the CT takes the basic slices as axial slices, and from that the other slices such as sagittal and coronal are being reconstructed, and the voxels are anisotropic, in the sense the coronal images will be slightly longer than that of the axial and sagittal images, whereas in a cone beam computed tomography all the slices are going to be very equal. So it just helps you to assess what is present actually. It's a real-time imaging modality which produces three dimensions. So the uses of CBCT, we call that as a CBCT, is multifold. It means it can be used to diagnose jaw pathologies, basically any tumors of the jaw, basically within the bone, any problems within the TMJ, that is the temporomandibular joint, that is one of the joint which is still elusive in diagnostic means, and any pathology of the TMJ, and root canal treatment, that is called as endodontics, to find out if there are any additional canals or any missed canals and any periapical lesions in relation to that region, and assessment of fractures. So we will be able to know where the fracture is exactly present, and so that the surgeon will have a view in mind before operating, and that makes the surgery a bit simple. And it is also used in assessment of any anatomical variations that are present within the jaw, maybe a two nerve pathology, that is if usually there is a nerve called as the inferior alveolar nerve, it might be bifurcated or trifurcated, or if there is any additional branches from the nerve, all these things could be found out. And in cases for implant placement, that is most important part of CBCT, where the exact width of the bone, the length of the bone that is available to place an implant is diagnosed. And since it is a imaging modality that is particularly suited for a dental use, there are many softwares that have come up along with this. With the help of these softwares, it helps us to plan the implant placement precisely. Even we call that as a keyhole surgery. It means you don't need to open the gums to place an implant. Without even opening the gums, we'll be knowing the exact position of the bone, the exact thickness of the bone available, the width, height, and hence a keyhole procedure can be done, and that is capable with help of a cone beam computed tomography, with that of a guide that could be done with the CBCT. So in case of any critical areas in which the bone is not adequate and that implant could be placed only in a certain area, in such cases we can place implants using these guides rather than placing it with the free hand. If you place it in the free hand, you might injure the critical anatomical structures. And CBCT is a specialized imaging modality to view the hard tissues with sub-millimeter resolution, that is below a millimeter, with high diagnostic quality, which helps us to plan everything accurately, and that is present at Rajan Dental Institute. And hence I say, in Rajan you are in safe hands.